Okay. Okay. Hello, everyone. I'm Sakhaa Almadani, senior medical student from Saudi Arabia. I'll be presenting what I propose to be a health center in Mars Habitat Mission 56. Okay. First of all, I worked in this along with my colleagues, Arvand, Eduardo, Davey, and supervision of Professor Jolio. So the health center, these are the objectives. This is the outline of the whole of all facilities together. I'll be focusing on the health facility. The internal design. This is a very simplified example of what I want to have. Basically, it's going to be a three floors. The first one is going to be the ER. The ER is the emergency room in which astronauts could be like in case of any emergency, they're going to present to the ER, and also it can be used for regular checkups like for vital signs, blood pressure, heart rates, respiratory rate, and temperature. It's going to have a 3D printer. I'm going to talk more about that in coming slides. Also, disposal of waste materials is going to be done there in the ER. Along with blood, urine, and stool test samples, they're going to be taken. The equipments to take samples are going to be there in the ER. The second floor is going to be the clinic. The clinic is basically for any physical therapy, psychotherapy sessions. The telemedicine devices are going to be there, and like the most common needed medications, because some of them they're going to have to kind of manufacture them using help of greenhouse, but the most needed ones should be ready at all times, especially like the emergency ones. And also the VR headset, which can be used to help with surgeries in the OR. I'm going to talk about that. And it can also be used for psychotherapy sessions. Okay, next is the OR, which is the operating room. It's a sterile area. Not everyone can go there. Like the doctor, the nurse who can go there should be sterile at all time. It's gonna have a foldable X-ray machine for in case of any needed imaging, along with a small pharma lab. As I mentioned, it's gonna need some the precursors from greenhouse. So I imagine the internal design to be something like this, very minimal, very practical, and nothing's going to be like just everywhere. It's going to be sticking to a wall or something. And now next to the applied technologies. So what should we have? The machines are going to be in the OR. It's going to be fully equipped with a small lab and a foldable X-ray machine. And between each level, they're going to have a bed elevator, because the patient cannot just like walk upstairs to the next one. So they're going to have like kind of an elevator for the bed to go to the next floor. And the clinic is going to be equipped with all primary healthcare necessities, along with an AR room and printables. Sorry for the mistake. Okay, so next is going to be the possible resources to generate. It's going to be like going to have medications, sterilization solutions for the OR, since it's going to be all sterile, clean, and medical devices and equipments of any primary healthcare center, and the printables for the 3D printer. Regarding the management, which is basically how this center is going to be run, we're going to have the facility chef. It's going to, I imagined it to have like three astronauts, basically, a medical doctor. He or she could be an internist or an AR physician. So they can work with emergency situations, and a general surgeon, since the internist cannot perform surgeries. We might need a surgeon and a nurse. The nurse can help both the doctor and the general surgeon. So now this is more further explanation, the medical doctor will be in charge of the clinic and any non-surgical emergencies, like medical emergencies. The general surgeon will perform any surgery, any emergency life-saving surgeries in the OR with the help of the nurse, and the nurse will be responsible for periodic checkups, that is vital signs, and assisting both doctors as needed. So regarding the training of those astronauts, both doctors and the nurse should have a registered medical license and are well trained to work with the most common space health conditions. So you can imagine that I did not mention yet anything about about psychological health. So in addition to that, they need extra training regarding mental health, especially warning signs of any psychiatric disorders. And then they can be guided by a psychologist or a psychiatrist from Earth as needed. They're going to use the telemedicine device to do the recommended therapy or to take any specialized consultations. So every astronaut should be trained, like not only the healthcare staff, but also every astronaut in the habitat should be trained to perform CPR and BLS, basic life-saving skills, in case the medical staff themselves, they were affected and needed more guidance. Okay. Those are some videos I imagine they could be useful to watch. I can send the presentation to watch later. Okay, and then the resources needed for 1 week. They're going to need a first aid kit, of course. They're going to need ready-to-print designs of all needed medical and surgical equipments, since they can't just like design them when they're needed. So they should be ready to print whenever they need it. They can just print them using the 3D printers, and supplies from the greenhouse to make medications. And what to be provided to others, the guidelines. They should present to the health center in case of any health concern. Most of the medical conditions that happen in space are not medical emergencies and can be treated on board. So astronauts with common complaints such as motion sickness, headache, sleeplessness, and back pain can be prescribed medications as per established guidelines from Earth. And other common conditions like minor traumas, burns, dermatological and musculoskeletal injuries, respiratory illnesses, and genitourinary problems can be dealt with in the clinic or OR depending on the needs of each case. And then the protocols. Specific protocols for the facilities. The medical emergencies, they should be treated in the AR first, which is the first floor, or further referred to surgery if needed. The regular checkups can be done in the clinic, the second floor, or in the AR if they needed another backup clinic. And the OR, which is the third floor, can only allow scrubbed-in surgeons and the nurse and the patient. Like nothing not clean, not sterile can go in there. And okay, protocols for safety. Again, I mentioned the OR area has to stay sterile at all times. Surgeons need to scrub in before performing any surgeries. And disposal of chemical and biological waste has to be done properly in the first floor. Sharp objects need to stay contained in a safe container and disposed of safely after using. The OR can serve as an isolation unit when needed. It's going to have negative pressure, I imagine. So also, there was this quote, given this small risk in this healthcare patient population, the limited number of candidates and continually advising minimally invasive surgical options, the ease and safety of surgical prophylaxis currently appears to outweigh the logistics of treating either acute pancreatitis or cholecystitis during extended duration spaceflight. I mentioned this just to say that's an interesting study I read. It says that prophylactic surgery to remove the appendix and the gallbladder, it could outweighs outweighs the risks associated with it, and that could be done. But it has some ethical considerations regarding that. But I just mentioned it as an information. So next, protocols for international medical research and projects can be done in the healthcare center. And the VR headset can be used for guidance during surgery in the OR and for psychological therapy as well. The food micro production, we don't really have food per se in the health center, but pills and injectables would ideally be made in the pharma lab with precursors supplied from the greenhouse and other production facilities. And okay, regarding the 3D printers, since I already mentioned a lot about it, the surgical equipments are going to be printed. Medical devices that need adjustment of the size to fit each astronaut. For example, when they measure the blood pressure, they're going to have different sizes, so the printables should be ready for each size to print. And materials needed for physical examination in a specific medical device for diagnosis or investigation. And next, we're going to talk about technologies. The 3D printing, this is the most, this is technology that's going to be needed for surgical and medical materials. And what could be applied to daily life on Earth is reusing medical devices after sterilization, because that's what imagine would happen in the OR, and producing drugs instead of waiting for resupply. And how that would impact sustainable life. Yeah, the facility is one of the most important facilities to sustain human life in Mars. Logically, without a healthy crew that's able to function at its best with no medical conditions affecting their performance, it won't be possible to sustain life long term in Mars. And those are my references. And this is my personal contacts on social media. Thank you everyone for listening, and I'm open to questions.